Muscles of the arm. Anterior view. Coracobrachialis muscle. Origin proximal. Arises from the apex of the coracoid process of the scapula along with the short head of the biceps brachii. Insertion distal. Inserts into the middle of the medial surface and border of the humerus. Action flexes and adducts the arm at the shoulder. Innervation musculocutaneous nerve C6 and C7. Comment: the coracobrachialis is the smallest of the three anterior compartment muscles of the arm. The brachial artery supplies the coracobrachialis muscle with blood supply. Next comes the muscles of the arm. Anterior view. Biceps brachii. Coracobrachialis is the deep layer. Biceps brachii is the superficial layer. Origin proximal. The short head arises from the apex of the coracoid process of the scapula. The long head arises from the supraglenoid tubercle of the scapula. Now comparing both coracobrachialis and biceps brachii, both the origin is proximal. Both arise from the apex of the coracoid process of the scapula, but coracobrachialis short head arises from short head of biceps brachii, whereas biceps brachii, the long head arises from supraglenoid tubercle of the scapula. Insertion of biceps brachii of superficial layer. Insertion distal. Both muscle bellies join to form a flattened tendon that is inserted into the radial tuberosity. Opposite the elbow, the tendon gives off a broad aponeurosis from its medial side. This bicipital aponeurosis descends medially to fuse with the deep fascia of the forearm. Action: with the forearm partially flexed, the biceps brachii is a powerful supinator of the forearm. It is also an important flexor of the supinated forearm. It assists other muscles, though weakly, as a flexor of the arm at the shoulder. Innervation musculocutaneous nerve. But C5 and C6. Coracobrachialis of the deep layer has C6 and C7. Biceps brachii of the superficial layer have C5 and C6. Comment for biceps brachii include: as the name implies, biceps brachii. The biceps is a fusiform muscle that has two heads. Its insertion by the bicipital aponeurosis allows it to flex the elbow. Tapping the biceps tendon elicits the biceps reflex, testing spinal cord segments C5 and C6 that it innervates. The brachial artery supplies blood to this muscle, biceps brachii. So brachial artery supplies blood to both the coracobrachialis muscle of the deep layer and biceps brachii muscle of the superficial layer. Thank you. This is for the muscles of the arm. Next video is coming soon. Till then,